Hello everyone, myself Dr. Dinesh Sharma, and I'm working as an associate professor in MLT Department, Sanskriti University, Mathura. Here, I'm going to present a lecture on introduction, symptoms, types, diagnosis, prevention, and treatment of Candidiasis disease. Now, going to the introduction. What is the candidiasis? Candidiasis is a fungal infectious disease which is caused by the Candida albicans. And Candida albicans, actually, it is an opportunistic fungal microorganism which cause the infections related to the skin, related to the intravenous, related to the other organs of the body. Especially Candida albicans grows in all the parts of the environment or all the types of the environment and is responsible to cause the disease in each type of fungal infections such as superficial, subcutaneous, cutaneous and systematic infections. There are two forms of Candida albicans, that is a yeast form which is known as budding yeast and another form is hyphae. Hyphae is the thread-like structures. This is the basic structure in which form the fungal microorganism grows or infect a patient to cause the disease. The Candida albicans, actually, it is a harmless microorganism, but in some cases or in those patients which have very weak immune system, it is responsible to cause the different types of disease. If we talk about its structure, appearance, this is the image of its structure, and as we see in the image, there are budding structures of the Candida albicans as well as hyphae structures of the Candida, and these spores are called budding yeast, which is responsible for the pathogenesis of the disease. If we talk about the clinical manifestations of the Candida albicans or candidiasis disease, in candidiasis disease, we can differentiate candidiasis as they responsible to cause the infection at the different body parts. If we talk about the skin, they are responsible to cause the skin infections as well as genitals. Genitals, in both of the genitals, like male and female, they are responsible to cause the infections in the genitals of the male and females. They are responsible to cause the throat infection. They are responsible to cause the mouth infection as well as blood infection. In mouth infections, the curd-like structures, which you easily seen in this image, the curd-like structures also found or also reported in the candidiasis infections. If we talk about its epidemiology, it is well known infectious pathogen which is responsible to cause the infection into the male and female equally, but most of the cases it has been also reported that over 75% of women suffered from the Candida albicans infections, and the infections reported due to the Candida albicans in the female patients, this is known as vulvovaginal candidiasis. Vulvovaginal candidiasis. And as I told you that there are 75% chances or over 75% cases reported for the women infections. The reason is use of multiple antibiotic drugs, use of multiple doses or high doses of the contraceptive medicines. What is the reason behind this? Actually, reason is that these contraceptive medicines or these antibiotics are responsible for the change of the pH, and due to pH change, the normal flora which is already present in the vaginal region, that is known as lactobacillus. Due to the change of the pH, the lactobacillus is affected. The growth of lactobacillus is affected in the patients, and due to the deficiency of lactobacillus microorganism in the vaginal region, these candidiasis or these Candida albicans have the opportunity to cause the infection into most of the cases in the women. This is the reason behind the cause the infection of Candida albicans into the woman. So these are the reasons. And what are the persons who are reported as at higher risk? As I told you, babies which have the nappy rashes, or pupils which have suffered from the metabolic disorders, likewise diabetes, overweight persons, pregnant women, and as I told you in previous slide, that the women who have take the higher dose of contraceptive medicines, they are responsible, they have the opportunity to cause the infection, or Candida albicans have the opportunity to cause the infections. And the other people who work in the wet conditions likewise, who worked in the agriculture fields, or who works in the oceans, who works in the rivers or ponds, they are more susceptible for these infections. And one more thing, additional thing I want to told you, that most of the fungal infections have been reported in those patients who have very weak immune system. Weak immune system means if they are suffered from the HIV infection or AIDS, they have the weak immune system, and due to which these candidiasis or Candida albicans infections may be reported in those patients. And if we talk about the types of candidiasis, there are several types. They are classified in several types of the candidiasis due to the site of infection, and they are oral candidiasis. Oral candidiasis, when the infection is reported from the oral cavities, likewise mouth, pharynx, larynx areas, and oropharyngeal candidiasis, thrush. These are different types. Genital area, when genital area infected from the Candida albicans, then it is called as genital candidiasis or vulvovaginal yeast infections. They are, it is also known as yeast. And these yeast infections, when reported in the nappy rashes in the infants, so they are also responsible to cause the infant candidiasis. And invasive candidiasis, when these infections migrated to the blood streams, and through the blood they can migrate to multiple organs, internal organs, likewise kidney, liver, and intestine, heart, and they can cause the multiple candidiasis or multiple clinical manifestations for candidiasis. Pathogenesis, if we talk about the pathogenesis, as I told you, it is a opportunistic microorganism, opportunistic fungus, which can cause the infection into the healthy patient and those patients who have the weak immune system. So the weak immune system is the key responsible factor for the candidiasis infections. And as I told you in previous slide, that it is responsible to cause the vulvovaginal infection into the females. These infections, what is the reason? As I told you, the reason is use of high dose of contraceptive medicines, and it is also a part of pathogenesis of candidiasis infections. And I elaborate all the reasons for the candidiasis infection into the vulvovaginal diseases or vulvovaginal Candida albicans. And Candida albicans also transmitted from mother to the newborn babies. It is also a route for the transmission of the disease or pathogenesis of the disease. And these Candida albicans the spores of Candida albicans can be spread through environmental factors also, from infected person to healthy persons, and they may cause the candidiasis infections. Another cause of to cause the candidiasis infection or candidiasis disease, this is the sexual intercourse. So through sexual activities, this Candida albicans also transferred from the infected person to the healthy person. And Candida albicans, if we talk about the morphological structures or morphogenesis of the Candida albicans, as I show the image in the second slide, there are filamentous and bud yeast-like structures found or reported for the on the culture media for the Candida albicans. And these spores structures or bud-like structures can be cause the infection into the healthy patient. But one condition is there. These all infections mostly reported in those patients who have the weak immune system or have the metabolic disorders, as I described in the previous slide. And what is the symptoms of this disease? In Candida infections, there are different types of patches can be seen on the superficial layer. Superficial layer, as I told you, it is a superficial type of infection also. So the symptoms on the skin can be found, can be observed as the red, itchy skin and often leaking fluids. Sometimes, due to the Candida albicans infections, the boils are developed on the infected area. So due to the development of boils, in some cases the fluid comes out from these boils like structures, and they are also found on the buttocks of the patients, and in between the breasts these infections can be seen. Red color patches on buttock or in between the breast or in the vaginal region or in the lower vest region. These cheese-like structures or these red patches can be observed. If we talk about the oral thrush, there are some curd-like structures developed into the mouth when it is responsible to cause the oral candidiasis or oral Candida albicans infections. And the most common skin appearance for the disease, this is the red patches, which is found on the skin. And by these red patches, we can identify or we can diagnose the Candida albicans infection. For the diagnosis of the disease or diagnosis of the Candida albicans infections, we can take the sample from the vaginal region, from the blood, from the oral cavity, or from the ulcer-like structures or white curd-like structures. We can take the sample, and by using the method of KOH mounting or LPCB staining method, we can identify or we can diagnose these infections under the microscope. So when we use the KOH, potassium hydroxide mounting, potassium hydroxide is responsible for the degradation of all types of animal cells or animal tissues. So after applying the KOH, only Candida albicans or only fungal causative agent can be isolated and can be visualized under the microscope. So this is the best method, and we can use also the LPCB method, lactophenol cotton blue method. By this method, we can also identify the Candida albicans infections. And in this infection, in this LPCB method, the outer layer of the Candida albicans is stained by the blue color, which can easily observed by the under microscope. So these are some symptoms, or you can self-diagnose the Candida infections. If you feel tiredness, it may be Candida due to the Candida infection. If you feel discomfort, or if you feel some intestinal cramps, it may be due to the Candida albicans. If you have the high blood sugar and diabetic conditions and you feel some dizziness, then it due to the Candida albicans infection, and several other symptoms like irritation. And if you take the contraceptive medicines regularly, then you are more susceptible for the candidiasis disease. So treatment, if we come to the treatment, for the treatment of Candida albicans, we can use several antifungal drugs, which is available and well known to the markets, and you can take from the market these drugs. And the special drugs which is used, they are the amphotericin B, itraconazole, fluconazole, ketoconazole. These are the well-known antifungal drugs which can be used in the fungal infections. If you see in the slide, there is the mention of fluconazole. Fluconazole a strong antifungal agent, but especially used in the cases of mouth infection. When oral infection reported in the patients, then we can use the fluconazole. If the patient have cutaneous candidiasis, then we can apply the creams or ointment which have the antifungal agent, likewise fluconazole or itraconazole or amphotericin B, which can easily remove the infection or cure the patient. Deep candidiasis, or it is when the infection reported into the blood or systemic type of infection due to the Candida albicans, then we can use the intravenous supply or intravenous administration of the fluconazole. And fluconazole helps in the removal of Candida albicans infection in the blood stream. And along with this drug, fluconazole, we can use another other antifungal drugs also, likewise amphotericin B or itraconazole. We can also use prevention, a term which is well known in medical line. This is the cure is care is more than cure. So prevention is most important to take care of of various infections. So the prevention is proper hygiene, cleaning of hands, cleaning of all the clothes, and if we have any kind of irritation, itching on the skin, then we have to report to the doctor or we have to use the antifungal drugs for the treatment. And if any patient is infected from Candida albicans infections and he has the HIV infections also, then it needs more attention, more precaution, more prevention for the caring, for the treatment of the disease. This is all about for the Candida albicans. And Candida albicans is the infection, as I told you, it is a fungal infection. It is a dimorphic fungus which found in the in two types of structures, that is budding and filamentous. And that's all from my side. Thank you.